All right, I can see that we are live now. Hello, everyone. Welcome to this week's episode of What's the Tea here at South Suburban Family Shelter. Thank you so much for being here with us. We are here every Tuesday, though we are going to do something a little bit different after this week. Usually we stream at 2 p.m. Starting next week, we're going to start streaming at 1 p.m. just like we did before. We found that hour just works a little bit better with not only our schedule, but we seem to get a little bit more viewers during 1 p.m. So we're going to go back to that time and see how that works. So starting next week, you all, 1 p.m. Tea time. And don't forget your tea. Today, we're going to talk about a very important public health problem, which is elder abuse. So more adults are aging than ever before. How might this impact our communities and what can we do about it? So I have the honor of being able to have this conversation today with Ellen Ruzich from Senior Services of Will County. We're going to discuss the services that are offered for seniors, as well as some of the issues surrounding elder abuse. And I would like to just remind everyone that questions and comments are definitely encouraged. So we will have some time at the end of the episode for any questions or comments that you all have. And so please take advantage of that, especially during these live episodes where we get to answer those questions during the episode. So we look forward to all those questions. And Ellen, if you want to go ahead and introduce yourself, tell us a little bit about yourself, maybe your role at Senior Services of Will County, whatever it is that you want to share.
Sure. Hi, everybody. So my name is Ellen Ruzich, and I am the director of the Care Coordination Unit here at Senior Services. I've been here for about 6.5 years. So I've seen a lot of situations and am so happy to be here to chat with you all and give you some insight on what we do here.
That's awesome. So can you tell us just a little bit about what brought you to Senior Services of Will County?
Sure. I have been sort of in the social work field ever since I went to school and kind of dabbled in some different things. I happened to find a case manager position open with Senior Services and thought that would be a really great place to start with social work. And then I just fell in love with the work and the agency and the seniors themselves. So I just stuck around.
Okay, that sounds amazing. If you want to go ahead and tell us a little bit about what are the services that, what are the services that are offered at your organization?
Sure. So we offer a variety of different services. One portion of what we do is here at our actual building in Joliet, we offer different activities and classes for seniors who are able to get out of their home and want to get that social aspect with other seniors. So we do things from line dancing class, bingo, crafting, there's like a knitting and crochet. We have a wood shop in our basement. So all sorts of different activities. We go on trips. They're going on a Cubs game soon. They're going to a Sox game soon. They're going to the casino soon. So all different kinds of things in that area. What we do in my division is focus on more of the seniors in their homes and how we can keep them in their homes for as long as possible while they're still being safe and healthy, because they want to be independent for as long as they can. And a lot of them don't want to leave their homes if they don't have to. So we like to try and give them as many services in their homes as we can, which can include a home care aide, which can help them for a whole variety of things. Some of them just need help getting to the grocery store. Some of them need, way more care than that in terms of like bathing and getting dressed, reminders for their medications, cleaning of the house, things like that. So that's what a home care aide can do. We also help set up those emergency home response systems, which are more commonly known as like the life alert buttons. So we can set up those for them as well, because a lot of the seniors now, they live alone. So they really rely on that emergency button a lot of the times if something does go wrong. We also do home delivered meals. So that just helps them provide a balanced, healthy meal every day of the week that comes straight to their home. We also have automatic medication dispensers. We provide respite care for family members who are caring for their loved ones. Sometimes they need a break. Sometimes they have a vacation or need to do their own thing. So we can provide, a stay or an aid for them while their caregiver can get out. Just all sorts of different things. We can get them assistive medical devices if people need a walker or wheelchair, anything like that, grab bars, really anything they could possibly potentially need, we can figure out a way to get for them. We help them set up their Medicare, Medicaid, the whole range, basically. We can figure out a way to help them with it.
Wow, that sounds amazing. It sounds like you really do offer a wide variety of services. So what must a person do to get these services? What are the qualifications? How can they obtain these services?
Sure. So they have to be 60 years of age or older. And then they have to live within Will County. There are agencies just like ours in every county of Illinois. There is a care coordination unit that does the same thing as us. So if you know a senior who lives in a different county, there's an agency just like ours that can get them these same sorts of services. They have to qualify on a certain financial level as well in order to receive the services for free through the state. So that doesn't necessarily mean we can't give them the services or help them find the services that they need if they are over that limit. And then it varies. So like a single person has a certain limit. A married couple has a certain limit. There's kind of different levels and variations, but that's all something that we can go over with them personally when they get there. But it is based off of their assets, not their income. So lots of things qualify, lots of things don't, to kind of go into that. But our case manager will review all that information with them. And like I said, if they do end up being over the limit, we can still provide them with a list of the agencies that are vetted through us and through the state of Illinois to be reputable agencies that they can trust to bring someone into their home if they would have to privately pay. So again, it would just be a matter of providing them those resources rather than necessarily setting it up through us, but we can still help them figure out what they can do and what they need.
Nice. That sounds amazing. I'm glad to hear that there is some type of, like financial assistance available for those who need it. What comes to my mind is because I know here at South Suburban Family Shelter, we're in Cook County. So a lot of our viewers might be from Cook County. So if they did want to find out more about their organization, could they call you and obtain this information, or where can they get this from?
Yeah, absolutely. So they're more than welcome to call us. We can absolutely look up what zip code you're in and tell you what agency you would need to go to, because since Cook County is so large, there are actually several care coordination units throughout Cook County. So what we would do is look up your zip code and let you know the number that you would need to call. You can also look on, it's Illinois Department on Aging. They have a website, and on their website, you can look up, I'm in this location, who do I need to call? And you could do it that way as well. But for people who don't have access to the internet, or it's not easy for them to do that, you are more than welcome to call us here. Even though we might not be your people, we can help you figure it out. Okay,
that's good to hear that there are a lot of different services in Cook County, different organizations. So I'll go ahead and at the end of this episode, or if anybody is watching, we'll add that website into the comments, and if anybody needs that. But yeah, thank you for all this information. It sounds like your organization does so much, and it's definitely very needed, especially with this growing population of elderly. I hope that these organizations are definitely still around when I get to that age, because I can see that they are very much needed.
Yeah, absolutely.
So I was going to ask about your goal, but you did already cover that. But if you want to just talk about, what your goal is at the Senior Services of Will County.
Yeah, absolutely. So yeah, I touched on it a little bit. So our goal is to have seniors live safely, healthy, and independently in any aspect of their lives. And so however that needs to be done, we can provide it to them. But that's the main goal, is for my division specifically, is to keep them in their homes as long as they can. And so we will do whatever we can to get that done. Sometimes they do reach a certain point where that's not safe for them anymore, or it's not healthy for them anymore. And so then we do have to have those usually tough conversations with them to inform them that unfortunately it's time to take the next step. But then we also will help them take that next step. We'll help them find new living. We'll help them get into whatever sort of senior facility that they might qualify for, or, you know, however that might go. But we would help them fill out the application. A lot of times we can help them make, you know, a down payment or their first month's rent at a place too. So we try and facilitate those things as much as we can, but the main goal is to let them stay in their homes as long as possible.
Wow, that is amazing. I can imagine how many people don't know about these services, and I'm glad that we're putting this out there. You offer so much. So as you know, we are a domestic violence agency, so this question is bound to come up. So have you encountered any domestic violence situations throughout your career? And if so, what can you share with us about that?
Yeah, you know, unfortunately, it is something that still continues into the lives of a senior even. I think when people think of, you know, domestic violence or abuse situations, they're not thinking about a senior. You know, that's not the first person or the age group that might come to mind where that happens in. But it absolutely does. And we do see frequent situations of domestic violence or some version of abuse happening with seniors. So I have encountered, you know, a situation, just I can give you a general idea, but there was a married couple and the husband was starting to develop dementia and he was becoming physically abusive. And, you know, it wasn't necessarily with any ill intent. It was the dementia that was kicking in, but he was becoming very physically abusive towards his wife. And it was a really hard situation to see because she didn't want to leave him. You know, she didn't want to put him in another place. She wanted to be at home with him and take care of him, but it was not a safe situation. You know, and then we also see lots of different versions of abuse amongst seniors that revolve mostly around, you know, passive neglect or financial abuse. So those are just different variations that we see a lot with the seniors, is the passive neglect and the financial exploitation.
Okay, wow, that sounds really interesting. I'm sorry about if there's a lot of noise in the background. Seems like the neighbor is cutting the grass. But so a lot of people do think that the elderly, you know, domestic violence maybe doesn't exist anymore. It's definitely not talked about as much as needed. And it's important that we do raise awareness and talk about how that problem is definitely throughout the lifespan. It happens amongst all age groups. So these services that you offer are definitely needed. So can you tell us a little bit more about what other types of abuse do you see among seniors?
Sure. So a lot of times we see the passive neglect that I touched on, which is a family member or a direct caregiver is not providing the support or the care that the senior might need. And the reason that it's passive neglect is because it's not necessarily with ill intent. It's that they don't have the education or the resources that they need to provide that safety or that care to them. So a lot of times, you know, we'll see the situation and say, oh, well, you know, this caregiver is supposed to be the one that's providing the food or the medication or whatever the case is, you know, but they're working full time, or they just don't understand that they have to, you know, change a person who might not be able to move all the way, however many hours at a time, you know. So then we step in and we provide that education to them. We provide the resources to them, and we're able to assist them with getting those services in place so that, again, the senior can be safe and healthy. The other one is the financial exploitation, which unfortunately, I would probably say this one is probably the biggest one that we see amongst the seniors. A lot of times the seniors don't pay that close of attention to their own financial situation. because a family member is taking care of them or takes care of their financial situation. So they're not really seeing all of the behind the scenes of what's coming in and out of their bank account. Well, since we have to know what the person's assets are, we see their bank account. And a lot of times we'll say, did you know that your family member was spending this money or doing this with this money? Or a lot of times they'll purposely try and put them into a nursing facility, or want to put them in a nursing facility so that they can, get that senior's money. So, yeah, those are probably the biggest ones that we see with the seniors. Oh, I think you're muted.
I'm sorry about that, trying to block off the noise in the background. But what comes to my mind when you tell me about, all these different types of abuse that you see, financial, all of them, is that when I think of domestic violence, I know that every situation is different. So any type of situation where there's abuse, where there's power and control, there's all these obstacles to leaving. But I can only imagine that for seniors, these obstacles are actually a little bit different. Maybe they are dependent on the person who is abusing them. It could be so many different things. So can you tell us more about these obstacles to leaving? What might be stopping them? Maybe they do realize that they're being abused or taken advantage of. What is stopping them from, doing something about it?
Sure. So yeah, there are definitely obstacles with seniors when they're experiencing these situations. So, like that physical abuse that I touched on, that little story that I told, she said, this is my husband. I don't want to put him in a nursing facility. I don't want to be separated from him. I should be the one taking care of him. And as much as I can fully understand being in that situation, that is your loved one and you don't want to be separated from them, when you're in a physically abusive situation, it's not safe, and that's really hard to tell somebody who's been married for 50 years that it's not a safe situation for you. So a lot of times it's that whatever that bond is between a family member, that's really hard to get past. And then that's sort of similar with some of these other things too, is that, I know that my son is doing this or that with my money. However, he's my son. I'm not going to call the police on him. Why would I do that? We hear that a lot. They don't want to get their loved one in trouble. Okay, well, I can also understand that. However, this is not the situation that is appropriate for you or that you should be in. So, and again, a lot of it takes separating family members when there are situations like that. And that is probably the biggest obstacle, is that they don't want to be separated in some way, shape, or form from their loved one. And that is probably the biggest obstacle that we see.
Wow, that really sounds like a lot. There could be so much going on within just this one, case. What was also coming to my mind is that, if whether it is somebody taking care of them who's abusing them, they might need them for so many things. Maybe this person is, helping them just bathe or feeding them or taking them to these appointments that they have, or, whatever it is that they're helping with. They might feel like, well, they're helping me too, so I'm getting something out of this, or I need them.
Yeah, we definitely get that a lot too. Well, they take care of me, so it's okay that they do that. Well, not necessarily, but yeah, that is a big thing too. Well, they're the person providing all these services to me. So then what that could ultimately mean is that client would have to potentially go into a nursing facility or a senior facility, where then again, they're separated from their loved one, but they are dependent on that care that they're getting from their family member. So again, absolutely, it's a really tough situation that they face, because a lot of them don't want to leave their homes or leave their family members. So it's definitely difficult for sure.
Yes, I can definitely see that. So let's talk a little bit about this COVID-19 pandemic and how that has affected your work. Has it affected the rates of elder abuse? How has that changed basically your job?
Oh, yeah. So it has definitely made a big impact on us here. Um, the one thing that we really rely on is getting that face-to-face interaction with a client inside of their home. So that's what the case managers typically do, is they do home visits with the clients and get all the information from them to be able to set up the services that they need. So we're able to see their home environment. We're able to see the people that they're interacting with. We're able to see them physically to know, is there something that's wrong, or is there something additional that they need that we need to help them figure out. So unfortunately, with the COVID-19 pandemic, we got pulled from doing those in-home face-to-face visits, obviously for fear of spreading COVID-19. So all of the assessments were being completed over the phone with clients. So as you can imagine, that has made a huge impact on the ability for us to really fully understand what is going on with the clients and what their home environment is like, because we can't see that. And the majority of our clients don't have access to internet. They don't have access to Zoom. That would be great if we could Zoom with one of the clients and they could show us around their house. They don't have that. You know, a lot of them don't have a smartphone even that they could even just put us on there. Or even if they do, they don't know what Zoom is. They don't know how to get that going or work that out unless they have a family member who is able to assist them with something like that. Then we could absolutely set that up. However, it is not common in our population. So we really have missed being able to interact with those clients in that way face to face. We did have a very short period of time just recently that we were able to go back face to face with the clients. However, now in the past week, that got taken away again. So it was about 2 months that we were able to be back face to face with the clients. So we got out and saw as many people as we possibly could. And the amount of clients that we saw that were in an unhealthy place is very heartbreaking. There are many, many clients who have not had the assistance that they need. Their homes have become unsafe. Some of them are even to the point where they are uninhabitable anymore. And we have been able to do the best that we can to get them the services that they need and fix their living situation. Another huge impact, though, is that a lot of the seniors got very scared to let somebody into their home because the home care aides were still able to go in during this whole time to assist these clients. A lot of them started refusing the service because they were afraid. Well, what is this person going to bring in? I don't know what they're doing. I don't know where they've been. What if they get me sick? Which is completely understandable, but then they're going without that care that they need. So it has definitely been a huge struggle for us. It's really hard to even figure out how do we overcome not being able to see them face to face unless they're self-reporting the situation that's going on with them. We have no way of really knowing until we can see it ourselves. Like I said, unless they let us know, then we can get them whatever they might need, but it's been really tough.
Wow. That almost gives me chills, just everything that you're saying, because it's something that honestly it's kind of obvious, but it's not something that I had thought about. That's true. Most seniors, they don't know too much about technology, and that's our primary way of communicating. Me and you, we're on Zoom right now having this meeting. So a lot of them, unless they have somebody's help, probably don't even know how to log into Zoom. So I'm wondering, what is your primary way of like contacting them? Is it through telephone? Is it through mail?
Yeah, it's through telephone. So that's the best way that we have to reach them, which has also proven to be quite a struggle because a lot of times if they don't know that it's our phone number calling them, they're not going to answer. So there have been quite a few clients that we haven't been able to get a hold of. Luckily, the majority of the people that we interact with all have some sort of emergency contact somewhere. We can call some sort of family member or a neighbor or a friend that they have listed down that we can at least know, like, hey, are they okay? Can you let them know to call us? A lot of the clients who are already receiving the services from us, if we're calling to do their annual check-in and assessment, we can call the home care agency or whatever services that they receive from us and say, hey, we're trying to reach them. Is your aide going in? Can you tell the aide to have them call us? So we have kind of some workarounds with that. But yeah, everything though has been primarily over the phone.
Okay. Okay, so from my understanding, those 2 months that you did get to actually see them in person, you realized that, the rates of them actually needing your services are even higher now after COVID, whether it's maybe because of COVID, maybe because, they weren't able to get these services for a while.
Yeah, I think it's just been a combination. They haven't gotten the services in a while, or they haven't, wanted to reach out for whatever reason. Maybe they haven't gone anywhere for a while. I think some people are even afraid to go to the doctor because what are they going to pick up at the doctor? So yeah, it's definitely been a tough situation to figure out what's going on with them, what's going on in their home. But it's definitely been really tough to make sure that they're getting what they need these days.
Yes, definitely, definitely. I would want to share some tips that I got off of the website. I was just doing my own research on the topic, and on the website on the World Health Organization, I got some efforts to respond to and prevent abuse. So these are some interventions that could possibly be implemented in organizations or institutions where there are seniors. So some of these are mandatory reportings of abuse to authorities, and then self-help groups, safe houses, and emergency shelters. So definitely these resources are very much needed. Also, psychological programs for abusers would be helpful. Helplines to provide information and referrals. And then caregiver support interventions would also be helpful. So I just wanted to share the information that I found there. I don't know if you have anything to add to that. What are some tips for someone to either prevent or respond to some type of elder abuse that they've seen or possibly even lived?
Sure. So, preventing might be a little difficult. However, I would say the number one thing to prevent any sort of abuse or situation is that, and I'll just speak for if it's a person who is about to take care of somebody. If you're about to go into a situation where you need to take care of a loved one, please reach out to us. We can give you education. We can give you resources. A lot of times these situations happen because an emergency happened. An emergency situation happens with your loved one, and all of a sudden they can't be alone anymore, or they have to have somebody who's doing certain tasks for them. And in that emergency situation, it's just a whirlwind, and you take that person in, or you go live with that person, but you might not know what the right or wrong way to do things is because you just kind of got thrown into it. So I think the biggest thing to preventing any sort of situation is to reach out, ask what the best thing to do is, ask for help. That's a big thing, is that people don't want to ask for help. There's no shame in asking for help. You are taking care of somebody because you want to, or, you are in that situation where you might be the only one for them. Well, there's no shame in asking for help because they need the help. You're there to help them. We're here to help both of you, all of you, whoever it is. So that definitely reach out. Please just ask for help. We can help with so many different things, and we can just even give you tips. We have caregiver education series that we do, just different topics that we touch on to try and help. And if you yourself believe that you are seeing or hearing of any sort of abusive situation, please report it. So we obviously are mandated reporters. So any situation that we come across, we report it. And then we are there to provide whatever support through the whole process. But if you have an inkling that something is going on, report it, because even if there's not, then you have somebody who knows what to look for, what the situation is, how to get that help for them, and they will go and they'll check out everything, and they'll say, yes, this is an abusive situation, or no, I think it's okay. But even if they say, no, it's okay, you yourself will feel better knowing that you made that call because it was a potential situation. So absolutely reach out and report any type of thing that you might even think, just so you got an inkling of something because you heard this or you saw that, just report it. That's the best thing to do.
Yes, I definitely agree. And I just want to thank you again for all this really necessary information that you are providing us today. So I just want to remind all of our viewers that we're going to have some time for questions and comments before we move on to the next topic here. But I do want to talk about what can people do? What can people do to, if you have any like volunteer opportunities? I did see on your website that you have something called the Ambassador Club. So if you want to tell us a little bit more about that.
Sure. Yeah. So we are always looking for volunteers. We could never have enough volunteers because we have like a volunteer database, but that doesn't mean that everybody's available when we need them. You know, we just have a list of people that we can potentially reach out to. But if you're ever looking for volunteer opportunities, absolutely, we would love to have you. We're always looking for things. If you are a senior specifically and you're interested in coming to our services, because I believe we kind of changed the word of it. So Ambassador Club is now we call our Senior Advisory Council. So these are seniors who interact with us in some capacity in our center. And we meet with them and get their feedback on, you know, what do you think could be done better? What are services that are missing that you think would be beneficial? Because we want the seniors to be able to tell us, you're living in it. What do you think is needed? What could we be doing better? So we meet with them monthly to get their feedback and do what we can to try and fill those gaps that they are seeing in the community. But we always are, especially hopefully now we can start doing some community events, but I don't know so much now with COVID blowing up again. But we always are looking for volunteers for community events. A huge thing that we need is volunteers for transportation. We have a volunteer transportation program that we're trying to run because transportation is a huge obstacle for seniors. So if you're ever interested in driving a senior to a doctor's appointment, we need your help. But always looking for volunteers for events, any sort of volunteer opportunity. Absolutely, we would love to have you.
That's awesome. So the opportunity is out there, everyone. So and it's definitely a big need. So if anyone is interested, please reach out. And I will go ahead and go over to Lysandra to see if we have any questions or comments in the chat. Lysandra, do you see anything so far?
Right now, we don't have any questions in the chat, but I'll keep a lookout for them.
Okay, no problem. So if anybody has any questions, even after the video, you can go ahead and insert them in the comments and we will get those answered for you. But before we actually end this conversation here, I just want to ask Ellen if you have any last words, anything else that you'd like to just leave here.
Sure. I think just kind of leave you with, you know, don't rule seniors out for potential domestic violence or abuse situations. It happens. It might not be obvious because it's not necessarily going to be that you're going to see that physical abuse on a person because other situations happen with abuse and neglect with the seniors. So it might not be apparent when you look at somebody in their eyes, but it definitely is a huge issue amongst the seniors. So please, if you have any inkling of any sort of situation happening, please report it. You're welcome to call us and we can guide you on how to do those things. We can give you all the support that you need. Please, please don't hesitate to ask for help. That's what we're here for. We are here to help you. We're here to guide you. We will get you whatever resources or referrals to other resources that you might need. We're the hub. You reach out to us, we'll figure it out for you. We'll guide you in the right direction if we can't do it for you. Like I said, I'm sure a lot of you are in Cook County. You can call us. We can tell you where to go. If you do know people in Will County, please spread the word about us. Like you said, we have so much to offer. I think a lot of people don't know about us. We are here. We'll be here. So please reach out. We're more than happy to help answer any questions you might have. You could even ask for me personally if that makes you feel more comfortable. Ask for me, I'll help you, and we'll get you whatever you need.
Fantastic. Thank you so much, Ellen, for being here with us and for all the information that you've provided. That is definitely very necessary. Just thank you for being here, and thank you, Lysandra, for doing tech today. So I'll go ahead and leave it at that. We'll see you all next week. I'm not going to say same time, same place, different tea this time, because it's a different time, same place, different tea. So next week, we're going to do it at 1 p.m. So please join us next Tuesday at 1 p.m. for another Was the Tea episode here at South Suburban Family Shelter. Thank you all for being here. And also feel free to like, share, and comment. Bye.
Bye. Thanks.